Ladies and gentlemen, Florida is getting hit with leprosy. Yes, it is showing up in Florida, and they said this looked like it's going to be an endemic. So, rises in cases of leprosy in the southeast US point to the possibility of the disease becoming endemic to the region. And a high concentration of those cases were reported in Central Florida. In a recent published research letter, the Center for Disease Control and Prevention said that Florida is witnessing an increase in leprosy cases, lacking traditional risk factors, and recommending that travel to Florida be considered when conducting leprosy contact tracing in any state. The number of reported leprosy cases across the country have doubled over the past decade, according to the CDC. Citing data from the National Hansen's Disease Program, the CDC said there were 159 new cases reported in the US in 2020. Nearly 70% of these cases were reported in Florida, California, Louisiana, Hawaii, New York, and Texas. So they're saying the bulk of the cases are in Florida. Leprosy, scientifically known as Hansen's disease, has never been common in the US, with most cases previously involving people who migrated from leprosy endemic areas. But the new report shows that about 34% of the cases between 2015 and 2020 were locally acquired. So, about the Florida leprosy outbreak, according to the report, Florida may represent the endemic location for leprosy and recommends that physicians consider leprosy in the appropriate clinical context in patients who have traveled to the area, even in the absence of other risk factors. Florida is among the top reporting states for leprosy. 80% of the cases in Florida were in Central Florida. Central Florida alone accounted for nearly 20% of the total number of cases reported nationally. Several new case patients in Central Florida demonstrated no clear evidence of exposure or traditionally known risk factors. Leprosy is a chronic infectious disease. So they said usually it will primarily attack the skin and the nervous system. It can sometimes infect other parts of the body, like the lining and the airway passages of the nose, according to the Florida Department of Health. It has been around for thousands of years, with the earliest known records appearing in China and India around 600 BC. Despite its biblical description, the disease is not easily spread. About 95% of the people have natural protective immunity, according to the Florida Department of Health. Leprosy can be easy to treat, especially if it's addressed early. However, going without treatment can result in permanent nerve damage. Mhm. Okay, the microbacterium leprae bacteria is slow growing, and it can often take years for signs or symptoms to develop following exposure to the bacteria. Once the first sign of infection appears, it can take anywhere between 2 weeks to months for it to progress. Can leprosy be cured? Yes, it is a curable disease. Doctors prescribe antibiotics to patients with leprosy. Patients are typically no longer infected. They said after you take the antibiotics for a few days, you're no longer infectious. But the treatment lasts between 1 to 2 years due to the bacteria's slow growth. What are the signs of leprosy? The early signs include pale or slightly red areas or a rash on the body that is often associated with a loss of sensation in the affected area. Other symptoms are loss of feelings in hands and feet, dry, stiff, and sometimes painful skin in the affected area, thinning of the eyebrows and eyelashes, nasal congestion is sometimes reported. If the disease go untreated, weakness in muscles of the hands and feet can also occur. Leprosy is contagious and can be transmitted by untreated people affected with the disease. However, most people have natural protective immunity. Exposure to people affected with leprosy should still be avoided, especially among family members, as protective immunity is genetic. How leprosy is transmitted isn't fully known due to how uncommon it is. Scientists do know it's not spreading through casual contact, sexual transmission, or from the mother of a fetus. So, the prevailing theory is the high levels of the bacteria are developed in a person's nose and are spread to others not immune through prolonged contact. The CDC hopes local physicians can help identify and reduce the spread of the disease through their effort to report cases and their support in further research to assess routes of transmission. So, yes, a genetic study conducted at the National Hansen's Disease Program found that armadillos in the South US develop a high number of the leprosy disease. That bacteria that causes the leprosy, yeah, armadillos, huh? Transmission between animals to human is low, but the program advises people to still take proper precautions around armadillos. I mean, I don't think most of us are around armadillos like that, you know. And even if they were around, it is really not accustomed to us to be touching and picking up and even dealing with animals. And and I know our people, we ain't into messing with animals out in the wild like that. That ain't our thing. But y'all, what do you think about leprosy? Most of the cases are cropping up down in Florida, you know. And this man that you see in the picture was diagnosed back in 2022. And he was from Central Florida and got leprosy. Please leave your comment and subscribe. Don't forget to hit on the notification bell, and I'll see you on the next video. Peace, family.